All right, hello there, Jet. My name is Dana Gonzalez. I'm a family nurse practitioner student, and with your permission today, I'm going to be assessing your 12 cranial nerves. Okay? All right, so we've already checked his vital signs. They're all normal. Appearance is good. I don't see any obvious distress. So first, I'm going to check your olfactory, which is your smell. Okay, so put one finger on this and breathe in. Okay, and now put on the other side. Okay, good. And you're breathing okay? You're not plugged up or anything?
Okay.
Okay, good. All right, so now I'm going to have you close your eyes. Close your eyes. All right. And can you tell me what this is? Smell.
Cinnamon.
Yes, it was cinnamon. All right, one more time. Close your eyes. Keep them closed. And can you tell me what this is? Smell.
Coffee beans.
Yep, it's coffee. All right, good job. So your olfactory nerve is intact. Next, I'm going to check your optic nerve, which is what you use to see. So I'm going to stand about 6 feet away from you. And can you read this line right here?
F-E-Z-P-D-T.
Good. All right, so that is actually, his visual acuity is actually 20/25. Can you read the bottom one? Let's look at the bottom one.
E-C-T-P-N-L.
Okay, good. There's 20/20. That's what we were looking for. Okay, and you don't wear glasses or contacts, do you?
No.
Okay. So he has 20/20 vision without use of corrective lenses. Next, I'm going to do check your acuity, or visual field. Okay, so just tell me when you can see my fingers wiggling.
I can see.
Okay. Look straight ahead. Look right at me.
I can see. I can see.
Okay, good. Now, cover your right eye with this. No, you hold it. Hold it and cover your right eye. All right, tell me when you can see my fingers wiggling.
I can see your fingers.
Okay, look right at me.
I can see your fingers. I can see your fingers.
Okay, now cover up your left eye. And same thing, tell me when you can see my fingers. Keep looking right at me.
I can see your fingers.
Keep looking right at me.
I am. I can see your fingers. I can see your fingers.
Okay, good. All right, we can put this away. All right, so visual field is good. Now I'm going to look in your eye. Okay, so I'm going to move this chair a little bit. I'm going to come over here. Just look straight ahead, okay? Nope, look straight ahead. Just keep looking straight ahead. Oops. Hold on, what you just did. Okay, just keep looking straight ahead. All right, there's the red reflex. Keep looking straight ahead. You're doing good. Is it bright?
Yes.
Sorry. All right, let me try again. Looking straight ahead. All right, so I can see the vessels, and it doesn't look like there's any, sorry, I'm still kind of slow with the eye stuff. So it didn't look like there was any papilledema. The vessels were intact. I couldn't really visualize his disc, but everything seemed okay otherwise. So next I'm going to check your pupils. All right, so just keep looking straight ahead. Look right at my nose. Okay. All right, so his pupils were equal and reactive. They went from 4 millimeters down to 3, which is appropriate for his age. They were round, equal, symmetric. So pupillary response was good. So now I'm going to check your near and far. So what I'm going to do is just look right at this pencil, and now look over my shoulder. Just with your, look at the pencil, now look over my shoulder. Okay, all right, and I see his pupils were constricting. Okay, and now follow this right into your nose, okay? Okay, good. So there was no convergence. And next I'm going to check your extraocular eye movement. So that's testing your oculomotor nerve. All right, so just follow the tip of the pen, okay? With just your eyes, not your head. Head straight. Sit up straight. All right, so his extraocular movements were equal and symmetric. I didn't see any nystagmus with any of the movements. So your oculomotor nerve is intact. Next, I'm going to check your trigeminal nerve. So I'm just going to put fingers right here and go ahead and clench your teeth down. Okay, good. And then again, relax and clench your teeth down. Okay, so the temporal and masseter areas were equal and strong. And next, I'm going to check your sensory. Okay, so I'm just going to touch this in a couple of places, and you tell me if you can feel it. Okay, just look straight ahead. Can you feel it? Yes or no? Not really? Can you feel that? All right, now look over that way. Eyes, eyes nice and big and open. Okay. And now look over here. No, just with your eyes. Look over to the right. All right, so his corneal reflex is also intact. Next, I'm going to check your facial nerve. All right, so raise your eyebrows. All right, let's squinch them. All right, and smile big, showing your teeth. All right, puff out your cheeks. You're wiggling so much. Okay, so that was all equal and symmetric as well. I didn't notice any deviations on either side. All right, so facial nerve is intact. And next I'm going to check acoustic, which is your hearing. So I'm going to come behind you and I'm going to rub one ear and then whisper in the other ear, and you tell me what 3 words I'm saying, okay? Repeat it.
Pizza.
You don't have to whisper it, say it out loud.
Butterfly. Sandwich.
Okay, good. Now I'm going to come over here and I'm going to do the same thing. I'm going to rub this ear and you tell me what words I'm saying, okay? Say it out loud. You don't need to whisper.
Yellow. Pumpkin. Durian.
No, the last one was turtle.
Oh.
You did good though, so you passed. So your hearing is intact. So now I'm going to assess your glossopharyngeal and your vagus nerve. So I'm going to open this up. I want you to stick out your tongue for me. Oops, hold on, I gotta get my pen right here. Stick out your tongue, open wide, and say ah. Okay, so the uvula rose in its midline, and his palate's intact. Everything looks good. I didn't notice any kind of deviation in the tongue or uvula. And now I'm going to check what's called your gag reflex, okay? So this is not going to be super fun, but I'm going to have to stick this down in your tongue. Yep. Okay, just open wide. Say ah. Okay, gag reflex is intact. Thank you, Jet. All right, and last, or not last, but I'm going to check your spinal accessory nerve. So really what I just want you to do is shrug your shoulders up. Oh, okay, you're so strong. And then Turn your head against my cheek. Try to turn your head to the left. Okay, good. Now turn your head to the right. Okay, good. So spinal accessory nerve is intact. And then last is the hypoglossal. So stick your tongue out. Okay, and move it to each side. Okay. All right, so hypoglossal is also intact. And I'm pretty sure that concludes our assessment of your 12 cranial nerves. Thank you, Jet.